Hello everyone, thank you for joining. Just so you know, this session is recorded. So today's webinar, we're going to go through a couple of releases we've had a couple of weeks back. Any questions you have, please pop them in the chat or raise your hand and we'll get to them as soon as we can. And also we've got Emma joining us on the call, who's the product owner for Engage Consult, and she'll be taking you through what's coming next. So any questions you have for her, please let her know. So I'm going to share my screen. You should be able to see my screen now. So just to discuss what we're going to go through today. So recently we've released the ability to configure your medical questionnaires. So I'm going to go through that today. The updates to the patient portal, going to go through the total triage feature we've added, and then we're going to go through what's coming next. So I'm going to go through those now. So first of all, around the questionnaires. So if you have management console access, so this is configured at my.engage.gp. So as you go to your menu on the Engage client, you'll see the management console. If you haven't got access, you need to enable it at my.engage.gp, which we do have a guide on how to do that, but you can always email me if not. So if I click onto the management console and scroll down and click on questionnaires, you can see you now have the option whether you want to use the advanced questionnaires. So the advanced questionnaires are those IMH questionnaires, so instant medical history of the branch and logic. So you get that detailed report from the patient on their complaint. So if it was a rash, for example, you'd get that full detailed report depending on what they answer. So you can now deselect to use advanced questionnaires, and instead, when they go through to submit a medical request, they'll just be asked ICE/custom questions. So you get complete control over that now as a practice, what information you want from that patient. So just to take you through, if you did have advanced questionnaires enabled, you can also choose to allow that user to end questionnaire early. So if you want that button to show, you can enable that, but if you don't want them to be able to end that questionnaire early, you just need to deselect that option. So for my one, you can see I've disabled my advanced questionnaires. So currently, when my patient goes through, I'm asking these questions here. So we do have the default ICE questions you can use, or you can go in and add your own questions and customize the questions. So you can go in and edit the question and pop in any text you want that patient to answer, but you can also select as well if that answer is required. So you can select if that answer has to be answered by that patient or if it's optional, so you get control over that as well. So you can see down the side here, you can just tick and untick which questions you want that patient to have to answer or which ones are optional. You can also change it as you could before. So as I go through as a patient, I can select if it's a new problem, existing condition, or get back in touch. So you can configure the questions depending on what the patient picks. And again, we do have the default questions for those, but you can add in your own ones and remove any that are not relevant to you. So that's the first point, so around the questionnaires. Obviously, if you want to keep advanced questionnaires and still ask the ICE/custom questions, you still can. All you'd need to do is ensure it's selected and then obviously add your ICE questions in as normal. If you didn't want to ask the ICE questionnaires, you just need to remove them and they won't be asked to the patient. If you have any questions around that, please feel free to ask them in the chat. Pop your hand up or you can email it over to training@engagehealth.uk. So that's the questionnaires configuration. We've also now brought over to the management console the Engage Consult Services tab, where you can go in and edit that patient portal. So you can edit the buttons they see as they go through. So you can see here you can click to add a service. So if I wanted to add the coronavirus link, for example, or I wanted to add my own custom link, you can choose the title and the subtext of that service, but also add that URL as well to signpost them off to that other service. So whether that's for a local group you've got, or maybe for the dentist, you can add those links in to signpost those patients off. You can also click to edit the service information page. So as a patient, when I click through on any of these buttons, like for medical consultation, for example, I can go in and edit the information page that they are shown once they've clicked through. So I can go in and edit this information, add links, format this text, so they then get the updated view as they go through to submit that request. So for example, on this page here for the medical consultation, I might want to add some extra information in around what information we need from the patient, why it's important to fill those questionnaires in, or perhaps you want to add in text on what days your doctors work, for example. So you can configure this to however is going to best suit you as an organisation. So once you've updated that information, when you then go look at your patient portal, you'll see that the text will be updated here. And if I click through to submit a request, this is where the text would change depending on what I pop in that service text. So that can be really useful, especially for the admin route as well. So you can pop in what you deal with as a practice through online consultations for admin query. Some people pop links in there for repeat prescriptions, for example. So please use this link for your repeat prescriptions, and that could potentially link to the NHS app. So it's just another way to signpost that patient off to another service or to give them the information they need. So that's the patient portal. So you'll find that under your management console now, called Engage Consult Services. And obviously you can go in and delete any services as well. So if you just wanted to use Engage Consult for medical consultations and not admin queries, you can go in and delete that service so it won't then display to the patient that they can submit an admin query. So you can completely configure it to what you request you can deal with as an organisation. Another new feature we've added recently is the ability to create a request on behalf of a patient as part of the total triage feature. So you can see here on my request, I've now got the create request button. So I can go into creating a request and pop in the information, but I can also do this from my toolbar as well. So I can open up my toolbar. I can pop it on the screen to where I want that to be. And I can go in, so you'll see now you've got a new symbol to create a request. So I can click create a request. So perhaps a patient's phoned up and you want to submit that request on behalf of them. You can now go through, select if the inquirer is the patient or not, search for that patient, pop in that patient's telephone number, and then select what inquiry type it is, so whether that's admin or whether it's medical. You can then go through and select, like the patient can, from those admin types, and then type in that query. So I can type in my query, click submit, and then when you go to your Engage client, it'll then be added as a request for you to then assign out to the most appropriate person. So that's how you can access the total triage feature. And as I say, you can either do that inside your Engage client or from the toolbar as well. So then we go on to what's coming next. So we will have a release next week, as long as everything goes through testing fine. So next week, what you'll see is we've got the structured data coming and the new request view, which you just saw me using. So I'll just take you through that just so you, when it changes over, you understand kind of how to use it and what it looked like and the different features from it. And I'll also show you structured data, how that looks in the clinical system. So if I go back to my Engage client, this is the new request view. So you can see it's changed slightly. So as you hover over requests, it highlights them so you can see which one you're selecting. Any unread requests are highlighted in blue and are bold, so you can see easily the unread requests. But also we've added these symbols. So At a glance, you can see if that patient was shown an alert, and as you hover over those symbols, it will tell you what they mean as well. But also, if you've selected you're waiting for the patient to respond, you'll see if you've got the little waiting for patient sign as well. So it's nice and easy to look at those requests from this message request view page and see what is currently going on with that request. You can see you've also got those same priority tags, whether that's same day, urgent or routine. You'll get the request, and obviously it's a cough and the patient's information. You'll see who they selected they wanted help from and where that currently is sitting, so what group or colleague that's sitting with. And you'll also see the last note or message from the patient as well in that first view. Other symbols you'll see is if that message was locked. So let's say a colleague was in this request at the moment, a locked symbol will show, so you can see that request is being dealt with by someone else and that request is currently locked. You'll also see at the top here, you can go to your open requests, but you can also go into your completed requests as well. And you'll see again, if they've been added to the clinical record, you'll see the symbol to say they have been added. So it's a nice and easy way to check if they've been added to the clinical record or not. You can also go to all and view all the requests together if you needed to as well. And obviously you've got your filters as you did before to be able to filter through those requests. When you then click on a request, again, we've updated the look. So you get the patient's information, but you can also go through and open that patient record from this symbol here. You now have these buttons at the top, so you go through to verify that identity if they've a new patient that's come in. So you can click on the button to go through and do that. Obviously, mine's already linked. You can go and set those priority tags, whether that's urgent, same day or routine. You can contact that patient, whether you want to message them or start a video consultation. And you can go to action, so you can assign this request as normal, take it for yourself, add a note to this request, complete the request, send that to the clinical system or download the request as a PDF. So you've got them nice and accessible now just from these buttons to make those actions to that request. You've also got that waiting for patient toggle if you're waiting for the patient to respond to a message you've sent to them. And as you can see, we've split the request down now, so you can either see the full request, so I can see everything that's going on with this request, that original request that patient sent through, and you can see they answered the ICE/custom questions. You can see the messages and notes added to this request as well, but then you can separate it down as well depending on what I want to see about this request. So I can look at request details and see what the patient submitted, the patient's name and information, and also the inquirer's name if it was submitted as proxy. I can go into notes and just see the notes added on the request and go in and add any other notes. I can go into messages and again see any messages that have come from the patient and any messages I have sent, and go through to message that patient from here. And we've got the audit log. So anything I do on this request is logged, so I can see who's looked at this request and why things have been changed. And we have the readings tab, which I'll show you on the health data request. So if I go to this one, for example, so we've had some blood pressure reading from a patient. When I go to the readings page, you'll see the last time they submitted that blood pressure, but also previous times as well. So you can see previous results of if they've sent through any health data, or you'll see the scored scales if they've sent through any particular questionnaires, such as your asthma control test, your PHQ-9 or your GAD-7. So it's nice and easy now to see previous results. You can just select from the drop down which information, depending on which information they've sent through to you. So that's the new request view and new message list. I mentioned around structured data, so again, you'll get the choice over this. So whether you want it to be, when you send to clinical, to be uploaded as a PDF still in the clinical system as it does now, or if you want it to go in as structured data. So just to show you an example of that, you can see on my screen now, this has gone in as structured data, so it's still coded as an online consultation. You'll see that we asked the ICE/custom questions for this particular one, and the patient was shown an alert. So when you send this to the clinical, you'll still be able to select and deselect what you want to show, and any attachments as well will get added. So obviously they sent us a picture for this particular request that's been added to the journal as well. So you can choose if you want it to look as so in the clinical system, or as before, just going in as a PDF and showing the title and any additional information you've added. Brilliant. Is there any questions around that at all? Did everything make sense, or do you want me to go over anything again? No. So if we go on now to the roadmap, so I'll pass over to, oh, sorry, does the patient see the notes? So the patient doesn't see the notes, but one thing to be aware of at the moment is when you upload the request to the clinical system, if you've got it allowed so the patient can see their patient record, they'll obviously see the notes if you haven't taken them out of that request as you upload it. So when you go to send to clinical, so if I do it on one I've got in my clinical system, so when I go to send to clinical, you'll be able to select and deselect those notes, so they won't then show in the clinical, in the patient's record. Brilliant. Any more questions before we move on? Thank you, Sophie. Perfect. So I'll pass over now to Emma.
Thanks, Anna. If you could make me a presenter, please, and then I'll be able to share my screen and show you what we've got coming. So currently in development, we are improving our questionnaire offering. So you should be aware that we have lots of advanced questionnaires that you can already send out to your patients. And they cover all the different conditions you can imagine, but they are advanced questionnaires with lots of branching logic. And we are aware that what you actually want is simple questionnaires that are coded, and they are based on long-term condition reviews, contraception reviews, medication reviews, or simply smoking status, alcohol consumption, things that will improve your cough data, for example. So if I share my screen now, and I will show you our prototype. Okay, you should now be looking at Engage Consult. So like I say, you already have the ability to send out questionnaires. It will just be some new improved questionnaires being added into that list. And your patients will receive those as a message within their Engage Consult solution. So if we see this message, request from practice, this has the new medication review questionnaire attached to it. So the patient would click on complete questionnaire, and they'll be told what the questionnaire is they're going to be presented with and how long it's likely to take, and they click start questionnaire and the questions will begin. And you'll see that the questions are presented in the NHS style. We follow the NHS style manual now to ensure that it's easy for the patients to understand and accessible. There's one question per page in a nice simple language. So if I just follow this questionnaire through, okay, as you can see, there are some radio button questions, there might be some free text, and there might be a little bit of branching logic. If you say you do have side effects to something, then it'll ask you to give some more detail. But essentially, it's a very simplistic questionnaire, just gathering the important information you need for that medication review. And the response has been submitted. If I now show you the mock-up of how that response will come through in the engaged client, you'll see that it's presented in a way that is what the question was presented to the patient, the answer they gave, and the clinical code that might be associated to that answer. So you won't be presented with any questions that they haven't seen. It is just what the patient has seen, what they've answered, and what's going to get recorded to their clinical record. And the most important thing I think is that we're going to give you visibility of those questionnaires. So before you send them out, you will be able to see what the questionnaire contains, what the questions are, and the clinical codes that are likely to be recorded back to the patient's record. So that's simple questionnaires, that's currently in development, so that will start being released in April for you, and we will build on those. So like I say, it will cover the long-term condition reviews. If there are any particular questionnaires that you would like to see, please do feel free to reach out to us to see if it's on our list, see if it's something we can add for you. I'll now move on to recording outcomes. We've got 2 stages to this. So when you send your request to the clinical system or complete it, you're now going to have the option to record an outcome. And the first stage of that will be to record the consultation method. So here you'll see I'm going to send this request to the clinical system. So still able to set the heading, title, add any optional detail and select the elements of the request that I want to be added. But here I have the consultation method, and we're going to try and help you out. If you've done a video consultation, for example, that will already be pre-selected to video consultation for you. So hopefully we'll reduce the number of clicks, but as you select and send that to clinical, that information will be recorded on the request and it will be recorded into the patient's clinical record. And the idea of this is to allow reporting to the DFOC-VC as well. The second stage will be recording the actual outcome, so a little bit more detail. So now you see when I send to clinical, I'll have the consultation method, which as I say, might already be set for me, but then we'll have that additional drop down underneath for the outcome. So what did you actually do? Did you give the patient advice? Did you issue a prescription, or were they referred to secondary care? Or it might be something else. You can say other and you can type your outcome in. And this was going to be a configurable list. So if I now show you the prototype for where we configure those. So this is going to be in the management console where you do all your other configuration. We're going to give you a default list to get you started, but you will be able to tailor this to your own practice. So you'll be able to edit those, remove them, add additional ones as you see fit. Obviously, you'll be able to report on these as well. That'll be separate. So you will be able to see which are most used, and you'll be able to report the outcomes of your online consultations. If you have any feedback on anything you've seen there, obviously, please do pop a message in the chat, or if you want to reach out to us later, we're very open to receiving feedback for all our new features to ensure that we get this right for you. Thank you, that's me.
Brilliant, thank you, Emma. So updates are normally automatic unless, do you mind just moving? Sorry, Emma. Unless you have admin rights. So if you have admin rights on your computer, you just might want to check you are on the latest version. So to do that, all you need to do is in the right-hand corner of Engage Client, go to Tools and select About and see what version you're on. So if you're on a version less than 13, that does mean you need to update. So you can either find the article on our support portal or just send across an email and we can help you ensure you're on the most updated version. So as I say, we should have a release next week of those new features we showed you. But any feedback you have, anything you'd like to see, please do let us know. Does anyone have any questions at all? And that can be on anything, not just what we discussed today. Is anyone thinking of switching? Oh, go ahead, Amanda.
Yeah, it's nothing very much. At the very beginning, you said something about the management tools. I was playing around on there the other day and it just wouldn't let me do anything. It said I didn't have the right user admin rights or something.
Yeah.
I'm the practice manager. How do I get the right permissions?
So what you need to do is you need to go to my.engage.gp and log in using your ODS code and a password that was set. So what I can do is I can see who we have down as the admin for that account if you haven't accessed it before, Amanda.
Yeah, I have accessed it before because I've got it saved.
Oh, perfect.
Yeah, but it didn't let me in. I went onto there. Let me just have a look.
So it's on a web browser normally.
Actually, it looks like the link that I went on went through my Wiggly Amps or something.
Ah, okay, so that was an older link from our previous name. So you just need to update that to my.engage.gp.
Okay, I'll try that.
And then what you do is at the top, you'll select engage client and staff, and then ensure you've got full management console access, and you'll be able to then edit any of those settings in there.
Okay. So the it's asking, I tried this as well. It asked for my email address and I put the same password in and it wouldn't do it. I'll pick up offline because I hate to say I've literally got to go to another meeting now. So
No problem. I'll send you an email,
yeah,
Amanda,
if you would,
and we
that'd be
can sort that
lovely.
out for you.
Yeah, thank you.
No problem at all.
Right, I'm going to run anyway. Thank you for your time, but I literally have got to go to another meeting.
Yeah,
Thank
of course.
you.
Thank you for
Thank you.
joining.
Bye.
Bye. Hi, Sophie. Did you have a question?
Hello. Yes, I do. I've been having issues with Engage recently. Patients are not able to respond to me.
Right.
I've raised it with an Engage via email, and they've asked me to change a couple of settings and make sure that the patients are selecting the gender and things like that. I've tried all of that. Lisa, my practice manager, has done a test patient. It's still not working. Do you know what I can do to get patients so they can respond to me?
So are they definitely going through as an Engage Consult account?
Yes.
So not a guest user. Okay.
Yes, yes. I sort of have the same patients messaging, so I know who they are. And yeah, they've all got accounts.
Right. Let me, what I'll do is I've got your email, Sophie, so I'll email you after the call and I'll chase that one for you, so we can get that working for you so patients can then respond. Sorry about that.
That's okay, thank you.
If just a thought, sorry, is it possible you complete the messages? Forgive me if I missed some of what you said. A colleague came to speak to me, but if you complete a message, then a patient cannot respond, and that is by design.
No, I leave them open.
Yeah, no, that's fine.
Up until it's completely finished, I leave the Engage completely open, and then I save it in the clinical record and complete it. Up until then, I don't complete it at all.
Okay, we'll obviously look into that for you. Thanks.
Thank you.
Brilliant. Any more questions before we end the call? I can see Amanda typing in the chat. I'll look into that for you, Amanda, because you should still have access. So you're using your ODS code and your password set. Brilliant. Well, if there's no more questions, that's the end of the call. As I say, please email training@engagehealth.uk with any questions or if you need any help. And also remember, you can book training sessions on there. So it doesn't have to be a training session about a particular feature. We do them for patient engagement, to help you with that side of things. So please just get in touch and we'll see how we can help you. And also, if you are thinking of changing questionnaires, so from the advanced questionnaires to ICE or custom questions, and you want some advice around that and how to do it, please just get in touch and we can help you do that. We also do have a Facebook user group you can join, which is called the Engage Health User Group. And on there we post when we do these webinars, any new release notes, and also you can pop posts on there as well and just ask other Engage Consult users for any advice you need, or see how they use it. So please do join. It'll be great to see you all on there and you can get support directly from the Engage Health team from there. So thank you all for joining. I hope you have a lovely afternoon. Yep, I'll get the link for the Facebook. I'll pop it on this chat, but I'll also add it to when I send out the webinar recording so you can join. Thank you, everyone. Thank you for joining.
Thanks. Bye.
I've just popped the group on the chat for you if you want to join. Thank you. Bye. Thank you.